all of you who follow Politics Done Right or been subscribing to Politics Done Right for a long time now know that one of my pet peeves is Medicare for all. And in that light, we talk about Medicare, Medicare Advantage, and all these other permutations thereof. Medicare Advantage, I have been calling it a scam for several years now because it is a scam. It is nothing more than private insurance that the government pays for people over 65 years. Government insurance companies never wanted to insure people at the age of 65 and older because they cost more. And they didn't want the risk of working with people that generally get sicker. So it was the government took responsibility and created Medicare, who's been doing a very good job for a long time. It needs a lot of improvement, meaning we need to make it 100% coverage. We need to make it take care of dental. We need to make it take care of ears. We need to make it take care of eyes. But it's being stopped by politicians paid for by the insurance industries and others so that they will be able to use those features as selling points. Well, in as much as they do that, what they haven't done is serve the people as they should. Again, their Medicare Advantage could never, ever be better than standard Medicare. It's simply math. It's simply math. For those people who are benefiting right now from Medicare Advantage, remember you are doing it at the expense of so many others that aren't getting the services they deserve, required, paid for, earned. And that means most people on Medicare Advantage ultimately will get shortchanged. And it is hard to get this concept across because too many people have the false belief that if something is in the private sector, somehow it is more efficient than being in the public sector, meaning that either government or some governmental nonprofit provides that service. It's not true. Math tells you it's impossible. And the reason it is impossible is whereas the government in administering Medicare does not have to pay for profits, shareholder dividends, doesn't have to pay for databases, advertising, etc. Because all those costs are not there, it means that if the government provides the same service being offered by these supposedly Medicare Advantage companies, math would tell you it is impossible for Medicare Advantage to be more efficient than what the government Medicare can provide. Now, I was very happy to see. I think we should give NBC kudos for this report. I made snippets of the reports that are pertinent that I want you to listen to, and then we'll take it on the other side.
Medicare Advantage, those Medicare-approved plans offered by private companies. Millions use them, but we found they routinely reject claims for necessary care. It's devastating hospitals in rural America.
This was once the geriatric psychiatry unit at Alliance Healthcare in Holly Springs, Mississippi. Beds sitting empty.
This operating room only a few years ago was doing 5 or 6 procedures a day. Now, 0.
Dr. Kenneth Williams is the CEO. He says the hospital can no longer afford the unit or any inpatient care for that matter.
It's empty. It died the last few years with Medicare Advantage.
Medicare Advantage is a private alternative to traditional Medicare pitched by celebrity spokesmen like Joe Namath.
Medicare Advantage plans have added new benefits.
31 million people are on the plans, which are often cheaper than Medicare supplements and promise better benefits and lower premiums. But the CEOs of rural hospital systems in 6 states tell NBC News that Medicare Advantage routinely denies reimbursements for necessary care.
2006, we went from being well in the black to losing $1.7 million.
Overnight.
Medicare Advantage. And nothing changed other than that.
One government report found the top Advantage plans denied payment for nearly 1 in 5 claims that met Medicare rules.
Your fight is not just to take care of patients anymore. Your fight is becoming more to get paid from the insurance company.
How dire is the situation when it comes to rural hospitals?
More than 300 hospitals that are at immediate risk of closure, and another 300 that could be at risk of closing in the next 6 to 7 years.
When Rose Stone retired, she signed up for a Medicare Advantage plan.
Rose, how long have you been coming to Dr. Williams' clinic for?
20 plus years.
And did you think if you signed up for Medicare Advantage, you'd be able to continue to do that?
At first, I did.
She was later surprised to learn the plan didn't cover her visits. Faced with paying out of pocket, she made a difficult choice.
I had to stop coming to Williams' clinic.
Rose has since gotten rid of her Advantage plan and is seeing Dr. Williams again.
You felt like you were taken advantage of.
I know I was.
Again, NBC, thank you for putting this report out. I tell you why, what brought me, I didn't see the report initially, but my brother-in-law called me up and said, Egberto, I just saw this report on Medicare Advantage. I didn't believe what you were saying when you were saying it. I'm like, you didn't believe what I was saying? And now that NBC puts it on, you believe it now? But I pause. I then get another email from a good friend of this show that told me, hey, I just saw what NBC had to say about Medicare Advantage. And so that's the report that you just listened to. Now, here's the hurtful part. All these network TV stations, radio, TV, print ads, all of them, they have been playing these Medicare Advantage commercials, ads ad nauseum. They have been playing them over and over and over again. Why didn't this report come out before? This report wasn't just made between the dates of December 7th and 14th. It would have been a lot more effective if this report came out before December 7th, which is the last day that folks could sign up this year for Medicare Advantage. So a lot of people who would have seen this report by NBC prior to December 7th, think about how they feel on December 14th when that report was aired about the dangers of Medicare Advantage after having seen all these ads, expensive ads for Medicare Advantage, minute after minute after minute. Folks, one of the reasons independent media is so important is because we are not limited by those who advertise on our network. Look, I first of all, I give utter kudos to NBC for having the courage to put this report on at all. But imagine how much more effective it would have been if it was done prior to the expiration of when you had to choose Medicare Advantage or not, especially since on your own channels, all these ads and commercials for Medicare Advantage were in full display. Folks, support independent media, because that is where you are going to get the unadulterated, unbiased truth. Of course, if it is in the nature of folks wanting to do you right.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.